Henrico County over the last 4 years or so has really supported the importance of doula as an intervention method to improve birth outcomes in the county of Henrico. A doula is a birth support worker that comes alongside of a pregnant individual and really supports and assists them during their journey being pregnant, while they're having the baby, and then postpartum. So they provide emotional support, they provide education, health education, they advocate for the pregnant individual, for the preferences that they want during their pregnancy. They try to bridge that communication gap between the individual and the medical providers and doctors throughout the process of pregnancy, birth, and postpartum. And then they often provide sort of a cultural bridge and translation between families and medical providers.
It was a great process. Having that extra, person to say, hey, Tiffany, did you take a break today? Did you drink your water? Are you being mindful and drinking, having your vitamins? It helped. Being in that stage of it, your hormones are up and down and your mind is racing and there's a lot going on. Even as a second-time mom this go round, it was a lot. It was overwhelming. And to have that extra person say, hey, are you being mindful of your self-care? Because if you're not caring for yourself, your baby's not getting the care it needs. And it made a difference to me.
I think the best thing about being a doula is being a part of someone's story, being a part of their journey, and having to walk with them in this very important time of their life.
So the Henrico Doula Program really supports connecting our Black families with doulas. When you look at the infant mortality rates in Virginia, we're at a certain number. And when you look at the infant mortality rates in the county of Henrico, it's higher, and that is specifically for our Black individuals. The doula program is one of our best tools to intervene in this space and to really help those outcomes to improve.
So for me, when I am meeting clients, I want to make sure that they feel comfortable with me like they would a family member, right? Because we're going into this very, very intimate moment together. I love that I'm able to support them, making sure that everybody is affirmed in their care.
She was able to just kind of ground us and center us and just be kind of like that advocate and that liaison between me and the doctors to just kind of make sure that I felt heard. And I think that's the biggest thing with using a doula, just feeling heard and someone that is on your side.
We want to encourage and increase the access to doulas, especially for our high-risk populations like our Black moms and individuals and families. Our current partners who are participating with us in this effort, Birth in Color and Urban Baby Beginnings, they're two of our core partners. They've been with us through the inception of this. Healthy Hearts Plus 2 is a great community grassroots organization that really has a heart for serving the community. They really focus on food as medicines. St. Luke's Legacy Center, another staple in the community, very passionate about supporting healthy births and healthy pregnancies. Family Lifeline is another partner that's going to be participating with our extended postpartum services. They actually provide family support specialists that specialize in home visiting education. It really is important and really gracious to be able to stand in the gap. It really is an important program and an important intervention to improve maternal child health outcomes here in Henrico County.